to local communities and programs. I'm Jerry Henchy, the facilitator for today's webinar presentations. We're looking forward to an exciting discussion with today's panelists about their work to promote early childhood healthy eating and physical activity. But before we get started, we want to offer some quick tips for participants so you can get the most out of today's session. We're very excited to have such a large audience this afternoon and to make sure that you can hear the panelists and the great information that they have to share. Each of you has been put into listen-only mode. If you have questions during the webinar, use the question box available to you in the control panel. So look to your right and you'll see a set of gray panels. So dashboard, attendees, polls, questions. Questions is where you would tap on that little box and then you can go in and submit your questions. So we welcome all questions and we've scheduled time in the last section of the webinar for speakers to answer questions. The other thing is that if you're having technical difficulties with your screen or the audio portion of the webinar, please let us know through the chat box so we can all see if issues are coming up. Child Care Aware and Nemours will be watching this, and their technical people will take note and they'll address your technical issues so that you can be part of the webinar. We also wanted to know that we're recording this afternoon's session, and we'll be sending you a link of the recording when it's posted, so you'll have that available. And after today's session, each participant will receive a certificate of participation. So moving to the second slide today, we really want to express our gratitude to the sponsors and the conveners of today's webinar series. And that is the Healthy Kids, Healthy Futures from Nemours and Child Care Aware of America. The convening is by the Early Care and Education Collaborative, which is an ad hoc activity associated with the Roundtable on Obesity Solutions of the National Academies of Science, Engineering, and Medicine. So we thank the conveners and those who are sponsoring this today. This is the final webinar in the Early Care and Education Innovations webinar series. So if we move to our slide talking about our webinar presenters, we have some excellent speakers for today's webinar. We have Dr. Rafael Perez Escamilla. He's the Professor of Epidemiology, Public Health, Director of the Office of Public Health Practice, the Director of the Global Health Concentration at the Yale School of Public Health. Then we have Krista Scott, who is the Senior Director of Child Care Health Policy, Child Care Aware of America. And then Jody Kuhn, who is the Director of Nutrition and Wellness at KinderCare Education, LLC. And then Tracy Ehlert, who is the Director of Babies to Kids Learning Center. The way that we've set up our agenda for today is that our first speaker, Dr. Rafael Perez Escamilla, will set the stage by sharing a report with the newest research and recommendations supporting the importance of good nutrition and feeding practices in the early years. Then we'll have the series of the rest of the speakers who will focus on efforts to prevent childhood obesity in early childhood settings through national and state initiatives and through experience and innovation in child care centers and family child care homes. Krista Scott and I will cover the national and state initiatives, and then Jody Kuhn and Tracy Ehlert will share their experience, innovation, and success in child care centers and family child care homes. So at this time, it is my pleasure to introduce Dr. Rafael Perez Escamilla. I'll turn it over to you, Doctor.
Thank you so much, Gary, for your kind introduction, and I want to welcome all of our audience to the great opportunity that I have received to present to you the Healthy Eating Research, Robert Wood Johnson Foundation Feeding Guidelines for Infants and Young Toddlers, following a responsive parenting approach. Next. I want to first thank very much the panel conveners, Mary Story and Megan Lott from the HER initiative at Duke University, and also to my panel co-chair, Sofia Segura Perez. Next. And very importantly, I want to deeply thank the world-class panel that agreed to work very intensively throughout this process. As you can see, this panel includes a very multidisciplinary group of researchers and healthcare providers, including pediatricians, including social and behavioral scientists, as well as nutrition epidemiologists and public health maternal child nutritionists. Next. Why are these guidelines being released? First of all, because there is now indisputable evidence that early life feeding behaviors play a central role in establishing food preferences. Secondly, because the prevalence of unhealthy eating patterns and weight outcomes among US infants and toddlers is amazingly bad. And thirdly, because previous comprehensive guidelines in relationship to feeding of infant and toddlers are dated. Next. During my presentation today, first I will do a very brief overview of the infant toddler feeding and obesity patterns in the US, followed by the responsive parenting and feeding frameworks used in the development of our guidelines. And then I will go to the heart of the guidelines and summarize for you which are the main messages that they deliver. And we'll conclude with some thoughts about top research recommendations. Next. So first of all, the FEED study has really showed very clearly that the dietary patterns of US infants and toddlers are especially concerning, and this applies to very low rates of exclusive breastfeeding, short breastfeeding durations, the common introduction of solid foods before 4 months of age, the infrequent consumption, and I mean really, really infrequent consumption of green leafy and yellow vegetables, and very strong underconsumption of foods rich in fiber as well, together with an excessive consumption of calories, added sugars, and sodium. Next. So this is especially concerning as dietary patterns get established very early on in life, and as it can be clearly seen at the population level in this slide. For example, the relatively low proportion of calories coming from fruits and vegetables, and the relatively high proportion of calories coming from foods and beverages with added sugars and mostly refined starches, represented by the red bar, it gets established by 1 year of age and remains constant throughout the first 4 years of life, highlighting the need to establish healthy dietary patterns since infancy. Next. Of particular concern to the expert panel, the FEEDS data shows a very low intake and variety of fruits and vegetables among US children under 4 years of age. Next. Even though over 80% of women in the US are now choosing to breastfeed their infants, there are strong disparities across ethnic racial groups, ranging from 66% among Black women to 84% among white women. Likewise, the prevalence of any breastfeeding at 6 months ranges from 39% among Black women to 64% among Asian women, and the prevalence of exclusive breastfeeding at 3 months ranges from 29% among Black women to 52% among white women. Next. Among US children under 2 years of age, 7.1% have an excessive weight, with this prevalence being significantly lower among white than among Black, Hispanic, and Asian children. Next. The ethnic racial differences in risk of obesity as it pertains to Hispanic and Black children is also reflected in excessive obesity risk among women of reproductive age in those same ethnic groups. Evidence accumulated over the past decade indicates that this should not be surprising, as it is now clear that the risk of obesity can be transferred from the mother to the offspring through epigenetic mechanisms involving a maternal cycle and a newborn infant cycle that requires addressing obesity prevention even before the child is conceived, followed by the gestation and the very critical infancy period. Next. I will now turn to summarizing to you the key aspects of the responsive feeding guidelines for infants and young toddlers developed by our expert panel, keeping in mind parents and caregivers, health professionals, food assistance program staff, and early child care and education centers personnel as key target audiences. Next. The expert panel's recommendations are expressed as practical messages based on the best available evidence and current best practices in the field for promoting healthy nutrition, feeding patterns, and weight status for infants and toddlers from birth to 24 months. The guidelines development methodology relied on literature reviews on key topics, including how children learn to eat, review of high-quality responsive feeding randomized control trials, interviews with experts in the field, including practitioners and program staff. It is important to highlight that 8 panel expert meetings with specific consultations between meetings and multiple, and I mean multiple iterations to review the technical document containing the guidelines by panel members were the basis of the strong expert committee consensus methodology followed. Next. The guidelines focused on advising not only on the what infants and young toddlers should eat, but also on how they should be fed following a responsive parenting and feeding approach. As such, the key themes addressed were breastfeeding, infant formula and cow's milk, complementary feeding, beverages, transition to family meals, soothing and sleep, play and physical activity, screen time, food allergies, and food safety. Next. The panel defined responsive parenting as a parenting style that fosters the development of self-regulation that promotes physical, cognitive, social, and emotional development. The central principle of self-regulation encompasses different dimensions of feeding behaviors that are key to address for the development of lifelong healthy eating habits. Next. The conceptual framework behind the responsive parenting guidelines developed by this expert panel include 4 main dimensions: feeding, soothing, sleep, and physical activity / screen time. As shown in the diagram, all these dimensions are strongly interrelated with each other and combined determine modifiable caloric intake and expenditure, which are the key determinants of the child's weight. Next. Responsive feeding refers to a high-quality bidirectional interaction between the caregiver and child during the feeding process. Responsive feeding requires following 3 key steps. First, the child conveying hunger and satiety signals through motor actions, facial expressions, or vocalizations. Second, the caregiver recognizing these signals and responding accordingly in an emotionally supportive and predictable way. Third, the child experiences this predictable response to her or his hunger and satiety signals in a way that fosters self-regulation. Next. The expert panel fully acknowledged that in addition to parenting styles, responsive feeding also relies on physiological factors such as innate taste preferences and intrinsic factors such as a child's temperament. It also relies on a good understanding of changes in developmental stages that children go through and how they shape feeding behaviors, including the need for self-feeding and overcoming resistance to new foods through repeated exposure. At the heart of the responsive feeding framework, we can see the great importance of understanding how children develop their food preferences and how these get strongly shaped by the environment. Next. I will now move on to present some of the key feeding guidelines developed by this expert panel. Due to the health benefits that breastfeeding offers to children and women, the American Academy of Pediatrics recommends that infants be breastfed exclusively from birth until about 6 months of age. Once complementary foods are introduced, AAP recommends that breastfeeding continues until the child is at least 1 year old. Next. Regarding the how, the guidelines provide specific recommendations on how caregivers can find out if and when their child is ready to be introduced to complementary foods. As you can see from the slide, they are based on motor and oral development milestones, as well as demonstrating a desire or eagerness for food. These developmental milestones, which in most infants happen between 5 and 6 months of age, with of course strong variability among children, correlate well with a proper level of physiological development needed by infants' organs to be able to handle properly and benefit from solids, including the development and maturation of their gastrointestinal tract, kidney function, and immune system. Next. As mentioned before, responsive feeding relies heavily on properly identifying hunger and satiety signs and how these change as the child grows and develops. The infant and young toddler feeding guidelines provide specific advice for caregivers on how to identify these cues so that they can respond in an emotionally supportive way to them. Next. During the second semester of life, breast milk or formula continue to be a major source of nourishment, although it is also the time when infants should be offered a variety of fruits and vegetables, and especially breastfed babies should be introduced to foods rich in bioavailable iron and zinc. During this period of time, infants should transition from pureed to soft and then harder finger foods. Next, the guidelines highlight the fact that children learn to eat through diverse mechanisms. First, they acknowledge that maternal diet during pregnancy and lactation influences the offspring's preferences as flavors get passed through the amniotic fluid and breast milk. This may be why breastfed infants have been found to be more likely to accept more readily fruits and vegetables such as carrots compared with formula-fed babies. Young children also learn what to eat by associating the quality of the feeding experiences with specific foods being offered, by observing what their caregivers eat, and also by repeatedly being exposed to foods that they dislike the first time they get offered, such as bitter-tasting vegetables, some of which may take as many as 20 tries before the child learns to accept them. Therefore, caregivers need to be patient and persistent, always following an emotionally supportive or responsive approach. Next, during the second year of life, the guidelines focus on increasing dietary diversity, on teaching caregivers the developmentally appropriate portion sizes, and endorses the cow's milk recommendations from the American Academy of Pediatrics based on pasteurized whole milk, and strongly recommends to avoid or seriously limit foods that are rich in added sugars, such as sugar-sweetened beverages, as well as fruit juice and foods high in sodium and trans fats. Next. Key experimental evidence on the impact of responsive parenting on dietary and health outcomes has emerged over the past decade. The expert panel reviewed 5 very high-quality randomized control trials exploring responsive parenting/feeding interventions in order to inform the development of recommendations in this area. Next, all studies found impacts on desirable caregivers' responsive parenting feeding behaviors, and 4 trials found improvements in weight outcomes at 1 to 2 years of age, 4 out of the 5 trials. Next, the RCTs indicated that teaching parents to correctly interpret infant hunger and satiety cues is key for allowing the child to learn to self-regulate food intake properly. And that is why anticipatory guidance is very much needed. Also, it is important for caregivers to understand the sleeping patterns of infants and how rapidly they evolve during the first year of life. Next. The RCTs consistently emphasize the importance of allowing the infant and toddler to participate in family meals and to avoid distractions during meal times. Next. Responsive parenting feeding trials and including soothing and or sleeping components were successful at improving sleeping patterns and feeding behaviors, especially at night. The trials highlight the need to respond to infant crying and distress with feedings only when the child is hungry, and to discourage the use of food as a reward as this would condition the infant to expect to be fed when waking up or in distress, even when not hungry. Next. Finally, the committee acknowledges that the implementation of the guidelines by caregivers will require major changes, not only in their individual behaviors, but also in the systems surrounding their households and environments where they live. And we're talking about changes in the healthcare and early care and education systems. So professionals and paraprofessionals working in these sectors can also help empower the families and their caregivers to be able to follow these responsive feeding guidelines. Next. So you can imagine that when you put 14 experts in a room, they come with many, many recommendations for research needs. So that's what we did, but here I'm highlighting the top ones that I think are relevant for this presentation. First, conduct responsive infant toddler feeding studies among low socioeconomic and ethnic racial minority groups in the US, as these groups have been extremely underrepresented in responsive feeding research. Next, conduct studies to determine the ideal way of delivering the HER-RWJF infant toddler feeding guidelines to parents and childcare providers. And this delivery channel should consider the WIC program, the healthcare system, the early childcare and education centers, as well as home visitors from the healthcare system, including promotoras. Next. So the intersectoral coordination to provide the right environments for caregivers on infants and toddlers to implement the guidelines is also a priority recommendation for future research. Next. So to conclude, I want to make sure that you have the website address in front of you in case you want to access the full technical report, or if we go to the next slide, also in case you want to access the adaptation of the guidelines for the ECE settings as well as the WIC settings. Next. And I am extremely happy to share with you that I have been a member of the US Dietary Guidelines Advisory Committee twice, 2010 and 2015, and was one of the scientists pushing very, very hard for the inclusion of dietary guidelines for children under 2 years of age as part of our dietary guidelines for Americans. And thanks to a congressional mandate, they are now going to be included for the first time in 2020, and we sincerely hope that our guidelines will help inform the deliberations of the committee that is about to be formed to develop the 2020 dietary guidelines for Americans. Next. So I thank you very much again, and I am looking forward to some of your questions towards the end of the webinar. Thank you very much.
Well, thank you, Dr. Rafael Perez Escamilla. We really appreciate your excellent presentation, and you've done a great job of setting the stage for us today as we move forward. So let's move to the next presentation, which in fact is my presentation. So this presentation, I'm going to be focusing on federal programs, initiatives, cross-sector collaboration on supporting success for providers and communities. Next, so just to give you an overview of how I'm going to cover this, I'm going to talk about federal program initiatives first, and then I'm going to focus on cross-sector collaboration at the state and local level with a focus on the Child and Adult Care Food Program. So if we can move to the next slide, let me just say the two big federal program initiatives, if we're talking about, if we look back at what Rafael was saying and we look at the different parts of the system, if we think about what are the federal programs and what are their initiatives trying to promulgate rules, new rules that would help address obesity, we have two, of course. We have the new Healthier Child Care rules, the Child Care and Development grant rules from HHS, which govern subsidy, and then the new Healthier Child Care and Adult Care Food Program rules, which are great because they will mean that we have a new healthier meal pattern. So if we can move to the next slide, I think it's an opportunity to look at a pullout of the ECE system. And if we look at it on the state level, if we're going from the national initiatives, federal initiatives, down to the state, and we say, on the state level, what are the agencies that have the power, oversight, and authority to address obesity in ECE settings, we see that there are three. The Child and Adult Care Food Program, the Child Care Licensing, and Child Care Subsidy. So in terms of the federal initiatives that we're going to talk about today, there's two there. One is for the Child Care Subsidy, and Krista is going to talk about that. And the other one is the Child and Adult Care Food Program, which I've said is going to be my area of focus. Now, a new healthier meal pattern for the Child and Adult Care Food Program means everyone on that program goes by the new meal pattern, which is 4 million children in ECE settings. And then it means that nearly half of this, in nearly half the states, it also will change the child care licensing rules for meals and snacks because they defer to the CACFP rules. So it's going to have a very big impact, and it's an opportunity for a lot of state and local cross collaboration. So let's move now to that focus on working together for shared goals as it relates to the new healthier meal patterns for CACFP. Now, just to review, CACFP is a federal food program. And that means it's an entitlement program, so as many people as can participate can. It was already proven to be helpful in obesity reduction, but this new meal pattern will make a good program even better. And it starts soon. So if we want to look at the timeline on the next slide, we see that, of course, it's July. We know that. It's not news. But it's October is the implementation. That's the start of the implementation year. And so preparations are moving ahead quickly. And we're going to see this change begin to be implemented soon. So what can you do if we're talking about state and local cross-collaboration for the to help the implementation of this? And we were looking at the next slide. The question is, you might be asking yourself, what can you do? What are people doing? And then if we move to the next slide, well, I think people are doing a good job of working together on shared goals in terms of state and local action. And I want to review opportunities for partners for CACFP success. And by doing this, we can understand that this important federal initiative is coming down through the states and then will come down through local partners and will come to family child care homes, child care centers, and after school centers, and that there's a lot that's going on here and there are a lot of definite opportunities. So next. So here are the partners for success. There's opportunities to leverage or to build these state and local connections, CACFP partners, early child care and education, nutrition, obesity, and health, and others. Next. So of the many people who are on this call, I think you represent all different sectors within ECE, nutrition, obesity, and then the actual food programs. For each sector, I wanted to talk about what are some of the opportunities or people that you might want to contact. So if you are in a sector that wants to contact early care and education, the people who I think are important to these initiatives to help make sure CACFP is implemented well is state advisory councils, coalitions, interagency committees, initiatives, and ECE organizations. And then if you want to talk to the CACFP folks, then I think good people to talk to are the state agencies, the sponsoring organizations, which are nonprofit organizations which help family child care participates and centers and after school, and participating centers and homes are also good to connect with. So if you're in one of these other sectors and you want to talk to the nutrition, obesity, and health initiatives, or folks, look for the projects, look for the coalitions and the organizations that are focusing on that and that often operate through some kind of CDC support or a public health agency support. Okay, so those are the partners for success. Let's move to the next slide. Opportunities for action. So we're going to go over each one of these in turn, but the things that I think that have been successful and the things that I would recommend and I'm going to be talking about are engaging partners to promote the value of CACFP and the new healthier meal pattern, sharing or co-creating nutrition materials and trainings, organize state summits, work groups, and meetings, encourage interagency referrals and promotions. So let's look now next at the opportunities for messaging. So the new meal patterns coming in, it's really going to improve the standards, but it's going to be work and people are going to have to get used to it. So I think that everyone who's in all the different sectors can have a role in promoting that getting the word out that this is making a good program even better, that now CACFP will be the gold standard in good nutrition. There's opportunities for child care providers to market around that, that CACFP helps children grow healthy and strong, and that nutrition habits start early. So these are messages that should definitely get out there, should be connected with the messages that you may already be moving around the importance of good nutrition and early care and education, because we want to make sure that everybody knows how important this is and that it is going to be a success. And we want to make sure that all aspects of the community feel comfortable with this and know that it's important to their communities and to their children. So let's move on now to sharing and creating. So there are opportunities to share and co-create nutrition materials and trainings. So if we go to the next slide, we'll see some really good news, which is that USDA has a lot of training and materials around this new meal pattern, and they're continuing to come out with even more. But they have curriculum, they have materials, they have a lot of different revised guides, and these materials I think are helpful for CACFP, of course, but they're also helpful if you're working within the ECE community to improve good nutrition in ECE. These things will also be helpful, and they'll be meaningful to those of you who work in states where CACFP is in fact the standards for child care licensing. So one of the really good things about this, if we look at the next slide that we'll see, is that USDA has been very responsive and in dialogue with people and the communities all along, and their training and materials are going to be available in Spanish and English. And so what do we say to USDA for that? Muchas gracias, USDA. So this is great, and it's going to be helpful, and I know that many of you will find these materials helpful. So if we look to the next slide, I wanted to show an example of a state that worked together with an advisory group of a whole set of people from different communities and, including centers and homes, and then worked together with the CCDBG quality money and CACFP team nutrition money to produce this Wisconsin Department of Public Instruction promoting nutrition and physical activity policies and CACFP initiative, which included a lot of trainings and included guides that they did, which were great and could be used across the board for child care trainings and CACFP trainings. And so I think that is an excellent example of joint training and resources, and something which people could consider doing if you are working on addressing obesity in early care and education settings. CACFP changes now are a perfect opportunity to bring your expertise together with the CACFP community, work on bringing some resources together and really making sure that everyone has the training that's already done, as well as coming up with ways to maximize these changes across the board in ECE. So let's move now to working together on shared goals in terms of organizing state summits, work groups, and meetings. Well, there's a lot of different ways that this could be done. First of all, before I get onto the more complicated ways, let me just say that you could just contact the state agency and ask for a meeting if you're working on something that you think would be helpful, or if you're a CACFP person, you can always just talk to the state agencies. They're working really hard on implementing this, and they would, I'm sure, like any kind of cooperation or input that anyone would like to share with them. So that's the simple way, but let's move on now to things that would require a little bit more planning and organization. So the first one is an example of a local meeting around CACFP, which was put on. We worked with folks in New Jersey, and they had an initiative, Healthy Food, Healthy Start. So they decided as part of that, which was to improve the nutrition and physical activity and early care and education, they decided that they would have this meeting, and the state agency came, and then the child care centers came, and we did a whole training on the new CACFP meal pattern, and then we also walked through with people if they weren't participating, why not, and this was a great time to start. We also walked through with people as well as, what was in the rule, how they were going to implement it, and also took the opportunity to identify areas where they thought they would need more assistance, which then people who were working on this initiative worked with the state to follow through on. So these kind of meetings, I think, are not too difficult to organize. It also covered, there was a whole set of people who were working on it, and some of them were working on a Robert Wood Johnson initiative, and that was in New Jersey, and that was also connected, and part of that was around trying to connect inner city child care providers and children with healthier food, and so that was also important. And there was a lot of interest in going to visit, the community gardens and trying to work on farm to school as well. So this is, I think, a nice example of people coming together and really bringing all the resources from their different initiatives and being able to, move forward together as CACFP improves its meal pattern and nutrition standards. Let me move next to Born to Thrive, which was a summit that Minnesota put on. So they really did a great job, and their tagline was growing strong, smart kids through healthy eating and active play. Now, the initiative for this was, in fact, that Minnesota knew that there was going to be a new CACFP meal pattern. But the summit itself was focused on shared goals for a whole set of different partners and the people that we talked about before, all of you who are on the phone, all these different sectors, which Raphael also talked about, and trying to bring them together, have everyone be together on the planning committee, talk about what the shared goals are, and then talk about how, each sector had a panel and talked about what they were trying to get done, and then also talked about how CACFP was connected to that. And then they came up with a set of recommendations, and they've actually continued this forward. They have a newsletter that they're doing, and they really wanted to keep going with it because, they wanted to make sure that they could address the gaps in supporting caregivers as they were trying to build healthy habits in young children. So CACFP was the impetus, and it was certainly at the core, but so were a lot of other things since it all comes together. And it's a great summit model, I think, and it worked out very well. And so I would congratulate the Minnesota folks, and we were pleased to be able to work with them on that. So if we turn now to the slide on the Virginia Summit, this is the last summit I'm going to be talking about today. This is the most recent summit. We think that this summit worked out really well. This one was focused on the high-level leaders of each one of the sectors, and of course, you always want to include all three state agencies, CACFP, subsidy, and child care licensing. One of the things that I think was helpful here, which people might want to do if they were interested in a summit, is that we did a monkey survey, and the CCR&R sent it out. And we got a lot of feedback on, what were the things that people thought were going to work about the new meal pattern, what were the things they wanted more help on, what were the things that they thought worked about CACFP generally. And so that was very helpful as a basis for the summit, but it was helpful overall, I think, for the state agency implementing the CACFP change as a lot of good information to them as they plan their training. I think this kind of thing going forward as we move into the implementation year will also be very important because it's a year in which people are going to be learning what's working, what's not working. And it's a year in which I think, in addition to CACFP implementing these changes, the child care licensing will start to move forward on looking at this in terms of how are they going to implement these new meal patterns into childcare licensing. So that's it on the summits, the convenings, and the meetings. I think they're good ways for everyone to get together. Like I said, you can go from small to large. You know, FRAC does a lot of work on this, so if you needed any help, you could always contact us. So let's move now to the final point in our cross collaborations on bringing federal initiatives down to the state and local level and making them a success. And that is to encourage interagency cross referrals and promotion. So if we can move to the next slide. Again, let's come back as we're finishing up to this systems concept, looking at the state agency sort of power, oversight, and authority. When we're addressing obesity in early care and education, we have a lot that's coming through these three agencies, and it's going to be important as we move forward if we want to support the success of the CACFP, you know, new healthier meal pattern, both in CACFP and childcare licensing, and the other initiatives that are moving forward to address obesity in early care and education, that we have cross referrals and promotion. So we know that there's a lot more training going on now around nutrition, around issues that are important in childcare for health and safety. And we also know that CACFP does a lot of training on nutrition. So it's important to have cross referrals here. And the cross referrals need to be from the agency level down. So they need to be the policy of these agencies, and then the organizations that are implementing those policies, as well as the other organizations within the ECE system, should make sure that they're cross-referring, because it's a whole network of important training, and it's important that the child care providers know about what kind of opportunities there are in each of the systems, so that people can get synergy out of these great new federal initiatives as they come down to the local and state level. So if we move now to the final slide, I just want to say once more that I really think that there are great opportunities in terms of people partnering for CACFP success. I've seen them happen, but I know a lot more could happen, and those of you on the phone are important to that success. And so if we move to the next slide, I would like to say in summary that I know if we work together, we can make this good program, CACFP, even better. So thanks for listening to my presentation. I'm going to turn now to the next slide, which will give you a link to USDA's website that has the new rule, their fact sheets, training and nutrition education resources, and other helpful material. And now I am happy to introduce an outstanding advocate and ECE expert, Krista Scott, who is the Senior Director of Child Care Health Policy for Child Care Aware of America.
Thank you so much, Jerry. It's a pleasure working with this entire panel to share a little bit about what Child Care Aware of America has been doing to give kids healthy futures. So if you turn to the next slide, first I want to introduce those of you who may not know about Child Care Aware of America to my organization. We are a nonprofit membership organization that's turning 30 this year. We're celebrating our 30th anniversary all year long. And you may also have known us as NACRA. And we grew out of a state and local child care resource and referral agencies who really felt that they needed a voice near the Capitol to advocate for child care. So we support the ECE space generally, but also our member organizations, child care resource and referral agencies, by providing technical assistance, training, resources, best practice guidance, and we also do a lot of policy and advocacy work at the national level, and now we're starting to support states in their policy work too, to help make sure that folks are getting information about and get best practices and helping folks get access to quality and affordable childcare. Next slide. I also wanted just to share that if you're unfamiliar with what resource and referral centers are, they are agencies that are in localities and states across the country that help bridge parents, providers, community leaders, and policymakers on ECE and childcare. They offer direct services, planning expertise. They help families and communities ensure that children receive quality childcare through direct referral from parents to childcare settings. They also provide a lot of the training and technical assistance within states that help states make sure that they have a substantive and quality childcare system. So they provide a lot of the health and safety training and nutrition trainings for state agencies around the country. And finally, I just have to say that the work that our members do and the challenges they face and the strategies they use to overcome barriers really feeds into our policy agenda and the services and supports that we create. And there are more than 400 child care resource and referral agencies across the country. They cover almost every zip code. So if you are in a place, there's likely a resource and referral agency that can work with or for you. Next slide, please. So in 2015, we were blessed to receive funding from the Robert Wood Johnson Foundation to support our work that we called Healthy Childcare, Healthy Communities. The goal of this work is to help all children entering kindergarten achieve a healthy weight. And we thought the best way to really think about this is as a partnership with select states to figure out how we can leverage state systems to better incorporate health, nutrition, and active living policies, programs, and strategies in childcare settings. So our partner agencies are Alabama, Colorado, Indiana, Missouri, New York, and North Carolina. And we work together to help advocate for healthy active living practices. And we started with the state plans. State plans are essentially the applications that every state child care system has to do to the federal government in order to receive the subsidy dollars. And those requirements really help guide and support what the state decides its rules around licensed child care will be. So we started with state plans, looked at ways to figure out how to incorporate healthy active living practices in state plans. And then from there, we focused on the partnerships within states, making sure that to Jerry's conversation about bringing people together, who's at the table, who's having conversations about health and nutrition in childcare settings. Is the CACFP agency talking to the state child care agency? Are they talking to the licensure folks? Are they talking to the subsidy folks? To make sure that everyone's on the same page and has the same goals. We also made sure that we shared best practice spotlights between states. So not just what is Missouri doing and making sure that all the stakeholders in Missouri are talking to each other, but it allowed Missouri to talk to New York and North Carolina so they could share strategies and sometimes commiserate with shared struggles. And we also had the great opportunity to do some development of health and nutrition messaging work. So helping them get some language together to really develop targeted messaging, to build support, to build demand for healthy childcare communities. And last but not least, we partnered with them to do some focus group work around the childcare workforce, right? Because we know that we're asking childcare providers to do a lot, and we need to understand what their health challenges are, because the things that we're asking them to do on behalf of and for children are perhaps supports that they need for themselves. You can find information about all of our project work at the website below. And if you have questions or if you'd like further information, please type anything into the question box. Next slide, please. I want to highlight that in this work, partnerships with CACFP are critical. CACFP itself is, as Jerry mentioned, the default for nutrition standards across the country. And if you don't have your licensure folks talking to your CACFP state agency, you definitely have a gap and perhaps a not so great use of resources. So fostering that communication and that connection was a big part of what we did if it hadn't happened in that state already. If it had happened and there were some states where they already had great conversation, it was about asking the question of what's next. But really we were hoping to leverage training, technical assistance, and supports across those agencies so that we could make sure not just that CACFP was followed, and that folks were not just following the meal pattern, but participating in the reimbursement aspects of the program. But we also wanted to make sure they were having conversations about who is participating in CACFP and how can we make sure that the most vulnerable children and families have access to healthy meals, and so that they can also learn the skills and information they need to make healthy the healthy choice, and also strategies to help making sure that the healthy choice is an easy and affordable choice. Next slide, please. So one thing I want to point out to you is that within the child care system, they have the new Child Care and Development Block Grant that Jerry mentioned has certain requirements around health and safety standards that things like background checks and emergency preparedness plans that we are so happy to see that states are required to have now. But I do want to note that it's having requirements around health and nutrition, access to physical activity, and screen time reduction are optional areas for states to have policies. Now, the good news is pretty much every state has policies or requirements or regulations or standards around nutrition. And you can see access to physical activity is a little bit lower and screen time's lower than that. But that still means it's possible that there could be a lack of allocation of resources, compared to some of the other big ticket items. Next slide, please. The reason why I bring that up is because we want to make sure that we're integrating these sort of what I call optional optional areas under CCDBG into priority areas. States have the opportunity to fund several different things using some quality set-aside dollars, meaning those are dollars that the states can't spend on things like the subsidy. They have to spend it towards building a system that provides not just access to care, but access to quality care. And on this slide, you can see where quality dollars are allowed to be spent according to the Child Care and Development Fund Plan, CCDF plan, which is authorized by CCDBG, which I mentioned before. So you can see in bold, here are some of the places where we can integrate healthy active living in training and professional development, early learning and development guidelines, quality rating systems, resource and referral agencies providing parents and providers information and education about health and nutrition. Supporting efforts to develop independent program standards around healthy active living, and general compliance. So if they wanted to change regulations around health and safety to include nutrition, those are all places where they can spend this quality set-aside dollars. Next slide, please. And I wanted to show you there's also, again, an additional opportunity, because as time goes on, we're going to see states required to set aside even more money from quality dollars. So even though it's a small amount of money, you can see in fiscal year 2018, only 8% of a state's budget is going to be set aside for quality dollars. How can we integrate and have conversations about health and nutrition in a way that we can kind of scoop in and take advantage of that next 1% increase that we're going to get? It might not be a lot of money, but it certainly could be more than what's being allocated now. Next slide, please. I mentioned state plans before because that's kind of where we started with our thinking. State plans are what I think of as a skeleton, right? The CCDF regulations and the plans require what states must include, right? They're the bones that say what work must be done or what you need to have in place in order to receive your federal funds. And so things like state regulations, policies, those initiatives, right, those healthy active living not necessarily regulatory requirements, but standards. And the collaborations could provide the assurances or content that show how the state is meeting the CCDF stipulated requirements. They're the muscles that show how the work is going to be done. So for us, thinking about how we could come together and think about ways to increase or bring to light some of the collaborations that are happening already, to highlight them, get them into a state plan. Right? If it's in the state plan, it becomes a priority. Next slide. So we really focused on existing state regulations and policies. We looked at the political climate, existing partnerships and collaborations, and focused on ways to identify existing funding and how to leverage that so that we could have a large impact on the child care system overall. Next slide, please. Again, you can see here our project areas of focus, incorporating nutrition active play into state plans and systems, looking at ways we could do better around parent and consumer educations to include information on healthy active living, incorporating CACFP into referral systems, to Jerry's point, at state and local levels, understanding the impact of regulations in QRIS and helping get some grassroots advocacy working, examining staff wellness and the impacts of staff standards and practice changes on staff, and also thinking about collaborations outside of the ECE world. What are those community partners that are doing this work as well that we could use, that we could work with and partner with to help us achieve our goal? Next slide, please. So one thing I wanted to highlight for you was a project that that we really enjoyed working on. We did focus groups in each of our 6 states around messaging. Again, focusing on that building demand from a grassroots level. How are we talking about healthy active living in childcare settings? How do we get people to buy into the idea that yes, we need some baseline standards around how kids are active and what kids are eating and whether or not kids are using screen time in a smart way, in an active way, or in a sedentary way? So we use Spitfire strategies for message development framework, and we built upon a couple of existing messaging toolkits that were great, but not quite laser targeted to the child care direct provider audience. So we tested messages, we crafted some messages, we got feedback on nutrition, active play, screen time requirement messages, and we also got feedback for preferred names for the workforce. And I know that sounds kind of odd, right? But in every place across the country, you'll find that ECE providers may have different terms for themselves. Some call themselves providers, some call themselves classroom teachers, some call them early care educators. And the first thing about messaging is you need to know your audience. So if we didn't ask the question, what do you want to be called? We're already setting ourselves back and having those conversations. So we included that. We said, how can we talk to you? What is the respectful way to communicate with you? And how do you see yourself? And that, of course, really feeds into the messaging. Next slide, please. Some key assumptions that we made in crafting our messages that I would like just to share with you, because I think if you decide to look into messaging, we came from a values-based place and said childcare is important. We know it's a place where children learn habits, providers are influential, and they want what's best for children. And that while they might always want to do their best, they might not always be supported in doing so. Next slide, please. The other project I wanted to talk to you about is our staff wellness focus groups and quality care. We want teachers and providers to nurture kids that are healthy and ready to learn, and we need to understand if what we're asking them to do is comfortable for them. What do they feel like their health is like? To what extent have they experienced toxic stress, poor nutrition, and activity? And what's the impact on them? In asking them to do all of these things, promoting healthy active living. So again, we convene focus groups in our 6 states and ask them about we asked them about the relationship between their health status, about implementing practices with and high quality care. Next slide, please. Oops, sorry. So what we found there is that most staff are willing to and interested in promoting healthy active living, but sometimes they don't feel like they can. They feel like they're going to be judged themselves. But the good news is they also understand that when they're doing things with kids, it has a benefit to their own health. They see that, and they're interested in wanting to do more and learn more about that issue. So it's a great area for engagement. It is with child care providers. And I think that we at the state level, thinking down to localities, need to remember that when we're asking child care providers to implement policies or programs, we also need to figure out how to make it useful and important and impactful for them as well. So next, I wanted to share with you some case studies of partnerships that we've worked with around this work as well. In Indiana, we had some healthy childcare partners across the board. We worked with Early Learning Indiana as our prime, but they also collaborated with Jump In for Indiana Health. And we were also worked with their Department of Education CACFP program and their State Department of Health Division of Nutrition and Physical Activity, which runs their 1305 CDC grants. Next slide, please. We engaged them in conversations around mapping, but also trying to figure out utilization and using QRIS to support CACFP for other nutrition policies. But we encountered a challenge, which is the shifting political landscape. So in order to make sure that they were engaged and on the same page to work towards those common goals, we had monthly calls to connect stakeholders, and we shared information across groups. So that way, Early Learning Indiana knew what CACFP had on its horizon, and they were able to collaborate as needed. We also had reports out for their 1305 grants and any mini-coin activities that they had, so that stakeholders were connected around the supports and services that were happening across the state. That way they could also reduce redundancies and share information so that there was also alignment and consistency. We also shared resources with them. We gave them comparisons from other states. We gave them examples of recognition programs because they were interested in figuring out if there's some involuntary ways to support through a certificate or recognition program healthy active living practices. And we also, knowing that the QRIS landscape was not quite ready for some change yet, we still shared examples of QRIS language so that they could figure out what, when the time is right, what are the policy recommendations they're going to make. So they were able to identify gaps in participation in childcare providers and understand that gap so that could be a shared goal in the future. But some other work that we were trying to think through is how can we use their data to help tell a story about need and really direct them to ensure that it wasn't an issue of directing resources to non-participants, but that key stakeholders, those families that have multiple risk factors and really should be participating in CACFP, that there's targeted outreach. So we've been thinking about ways to help them use that GIS mapping, so looking at food deserts and scarcity issues, as well as their CACFP participation data, and so they're working with their grant funder to look at those overlaps and overlays using GIS data. Next slide, please. We're doing similar work in Alabama. We're working primarily with Alabama Partnership for Children, but we're also, and our other partners are Child Care Resources, Child Development Resources, and Voices for Alabama's Children, 2 quality contractors and an advocacy agency. Next slide, please. One challenge that Alabama brought up is that there have been declines in CACFP participation over time. And here you can see from FRAC's report, Child and Adult Care Food Program participation trends that they put out in 2014, you can see the decline in CACFP participation as well as an explanation as to why the decline happened. But they brought to the table that they were concerned about CACFP participation, and then also they didn't feel particularly connected to their CACFP organization. It was a goal for us to begin to branch out, and I'm happy to report that that's been happening. Next slide, please. So our initial goals were to improve nutrition, physical activity, and screen time limits in childcare programming. Again, linking through, connecting them to FRAC to get a better sense of what CACFP is and could be, to investigate some of what Jerry can bring to the table. And you saw in her presentation the way she's able to bring those key stakeholders together and get them mobilized. We also connected them to other state stakeholders and provided data and information on CACFP and vice versa, and connected them so that they could build solid relationships. We also did some cross-agency thought leadership and collaboration, and much like Indiana, we're thinking about how are we not just encouraging participation in CACFP for everyone, but how are we targeting those populations that really need targeting. Next slide, please. So we put together a slide, and so in the next few slides I'm going to show you some maps that indicate where there's some food scarcity and farmers markets. Our idea was when we have food deserts, farmers markets can often be a great way to mobilize communities around local resources to give back to community. It's a community revitalization strategy, and it also might just help providers access food if they can't get it at healthy foods in corner stores, or if they don't have access to grocery stores. So on the coming slides, you'll see light green dots are family child care homes, blue are child care centers, and red are license exempt centers. And the dark green circle is a farmer's market. So the goal of this map is to analyze the proximity of farmers and farmers markets and childcare providers. So we can see how close childcare providers are to their farmers. Next slide, please. So our example is Birmingham here, and you can see the gray areas. The gray areas show, right, that there's not a lot of access to farmers markets in some of those surrounding counties, right, where there are food deserts. And you can see the childcare providers are also clustered, but those childcare providers in outlying areas do not necessarily have ready access to a farmers market. Next slide, please. So we also did a map for Alabama's capital in Birmingham. And you'll see almost all of Montgomery is a food desert and a low-income population. There are only 3 farmers markets and 22 childcare providers. Go ahead, next slide. So you can see there, right, it's all food deserts, and there are, in Birmingham proper, in the center mass, those are your farmers markets. So you have a lot of folks who really could use and benefit from farmers markets, but they don't necessarily have access to it. So the purpose here is not to say that folks do or don't have access, but it's to help stakeholders ask those important next questions. Do they really not have access? What's going on? Who can we talk to in the communities to see if there's demand? Do we need to build demand? Do we need to mobilize to build demand? What would the impact be? Are the providers that have access to farmers market using them? What would happen if they did? Again, all just to ask questions so that we can better target our resources as appropriate and also expand access to healthy and nutritious foods. So that's an example of how we're using our data with our partners. Next slide, please. Oops, that was a duplicate. Sorry about that. Oh, next steps. So, oops, sorry, I was looking at the wrong screen. Back one. It's been a long day. Sorry, folks. So our next steps are really to think about, right, now that we have a sense of who the partners are, who we need to bring together, how can we also help them create demand for advocacy and continued work beyond the 6 states in nutrition, CACFP, and other healthy active living? So how can we continue to tell stories using GIS and data? How can we help them create messages that impact multiple stakeholders? And how do we mobilize advocacy groups around funding for access and resources and supports for nutrition training? And finally, can we continue to facilitate collaborations across state actors around nutrition, active living, and training needs and opportunities? So at this point, I will turn it over to Jody. I thank you guys so much for your time.
Thank you so much. My name is Jody Kuhn, and I'm the Director of Nutrition and Wellness for KinderCare. We are, let's go ahead and go to the next slide. Great. We are the nation's largest early childhood education provider with over 1,700 centers, after-school programs across the country. We serve over 160,000 healthy meals and snacks every day. At KinderCare, we know that an important part of our job as educators is helping children develop healthy habits. Grow Happy defines our approach to nutrition and wellness and guides what we do every day to create a culture of wellness in our centers and our classrooms. About half of our centers qualify for the Child and Adult Care Food Program because we're a for-profit participant. But we hold all of our centers to those same standards and in some cases even above them. So the USDA sets the meal pattern, but really our parents drive the improvements we strive to make, and we know it's the right thing to do for our children in our care. Go to the next slide. In order to understand our customers' expectations, we gather their feedback through multiple channels, including family chat sessions, where our executive team goes out into the markets and meets with the parents directly. We do center visits where we get to talk to parents and teachers and children to hear what they like and what they don't like, and even surveys directly to our parents. Next slide. And this builds nicely into Krista's conversation about partnerships. Partnerships have played a critical role in helping us adapt to the new meal pattern and also to meet our parents' expectations. I'll talk about partnerships with chefs, manufacturers, kind of an unlikely partner in the Humane Society, and with Partnership for a Healthier America. Next slide. So partnering with chefs has allowed us to present tasty and flavorful healthy options that kids will be excited to try and look forward to eating. Our partner chefs from Tyson and Nestle have come to Portland for ideation sessions, taking our current products, testing some potentially new products, and their research menu trends in restaurants to inform their recipe development to include in recipes children will want to eat. They have researched what children ages 2 to 5 are eating in restaurants and looked at consumer trends to create recipes that help us meet the demands of our customer population, align with the new CACFP meal pattern, and most importantly, reflect our Grow Happy nutrition commitments. These sessions have resulted in new recipes and ideas for how to creatively menu products in a way that meets the guidelines, is healthy, and also kid-friendly. This has been a really important step in helping us adapt to the new meal pattern. We know that introducing new foods can be challenging, not just for the kids, but for the teachers and the parents and the staff as well. But using their research to make smaller adjustments and integrating more whole grains and vegetables into meals that the children already love is helping to make a smoother transition. On the next slide, we'll talk about our partnership with manufacturers. Given the scale and the reach of our company has across the country, we have an amazing opportunity to inspire healthier lifestyles among children we educate and to care for every day, including our parents and even our own employees. We also have the ability, and honestly, in my opinion, the responsibility, to help influence the industry to make healthy options that kids love more accessible. Like any big change, making the transition to healthier behaviors can start small. We're working hard to integrate healthier options with the foods kids love, like whole grain pizza crust and whole grain mac and cheese. Our pizza manufacturer removed the trans fats and created a whole grain crust version that kids still love. Nestle has reformulated their mac and cheese products to be at least 51% whole grain. And Dannon, we've worked with them to reduce the amount of sugar and remove the artificial colorings and flavorings from the yogurts we serve. Finally, Tasty Brands, the company that supplies our ravioli, created a new recipe and a new formulation that allowed us to serve fewer raviolis in order to meet the meal pattern, because we realized in order for a meal to be creditable for grain and a protein, we had to serve the kids a lot of raviolis. So we worked with them to help make it more nutrient dense. On the next slide, we set a goal last year to make a vegetarian option available every day. And something beyond cheese sandwiches, because the kids get tired of that. And we wanted to find recipes that all centers would use at least once each week for all children. We partnered with the Humane Society of the United States, and it seems like a somewhat unlikely partner when you think of nutrition. Sorry, there's a little bit of background I'm hoping we could put on mute. We partnered with the Humane Society so that they're an unlikely resource for nutrition, but they also have a great team, including registered dietitians focused on the plant-based lean protein options. They helped us come up with some great kid-friendly and easily to prepare vegetarian meals like lo mein, a chickpea biryani, and a Southwest Fiesta Bowl, which actually the cook in the picture was getting ready to prepare for the first time for her kids. And how could you not be excited to try a new meal when your cook delivers the meals that way on that day? That was really exciting. So let's go ahead and go to the next slide. Because of our relationship with Partnership for a Healthier America, or PHA, we had the opportunity to partner with the F&B campaign and the Honest Company to provide donations to some of our families and help us spread the word about PHA, F&B, which is a really cute campaign if you haven't checked it out yet, and our industry partners working with us to help end the childhood obesity crisis. Additionally, as I mentioned before, our conversations with Dannon about reducing their sugar came through our mutual partnership with PHA. Further, we have been in discussions with Del Monte about reducing our reliance on canned fruit, especially the canned fruit in syrup, and moving towards more fresh and frozen options. We're excited about continuing to work together to offer better quality and more nutrient-dense fruit to the children in our centers, and are looking forward to the possibilities of their new products. At our most recent PHA Summit, we reconnected with a partner we originally met last year. Green City Growers is an awesome organization that partners with companies to create gardens in somewhat unlikely areas. They're probably most known for their garden at Fenway Park, but they have created mini gardens across the country. They came to last year's PHA Summit eager to learn how they could support other PHA partners and so willing to listen to the needs of others supporting healthy choices. This year, they came back with a garden curriculum for children education partners, and we're so excited to explore this partnership because we know that when children have a hand in growing their own food, even if it's just an indoor herb garden, they are more likely and willing to try new foods. Next slide. And we can't forget our partnerships with parents, teachers, and children. These changes haven't been easy for us. Feeding children across the country means many variations in culture and parent preferences. Our changes have required some education of parents who did not want their children eating vegetarian meals. We heard, well, I don't want my child eating a vegetarian meal. We're not vegetarians. Or chickpea biryani because they'd never had a chickpea at home. Many in our organization were even nervous about our decision to remove juice because it's what many of us grew up on as children. Once in a while, we still get concerns from parents saying, why can't you just serve chicken fingers? I know my kid will eat it. We also have stories like this one. So one of my team members was conducting a CACFP monitor visit when she overheard a parent talking to a teacher. The parent was saying something like, can you show me this whole my plate picture? My daughter said last night during dinner we weren't ready to eat yet because there was something missing on the plate, and I just didn't know what she was saying. So they walked over to the poster of the My Plate, and it turns out their plate was missing a vegetable. So the daughter was not going to eat it until it was a complete healthy meal that met the My Plate standards. So in this case, the 5-year-old was helping to educate her whole family about what a healthy meal should look like. In order to help with these changes, we've created an Introducing New Foods resources for our cooks, our teachers, and our families. We tell cooks all the time they have to leave their yucks at home. They can't bring their negative food experiences into the centers. And they have to get to know their classroom. What meals do your children love? How can you integrate new products with the meals that you know kids love already? Parents also need that help with the education. We have some pockets of the country demanding these changes while we still have a diverse population and others are resistant. So one of the most recent changes, especially with the chickpea biryani, the lo mein, and the Southwest bowl, we provided recipes that were scaled down to family size and encouraged them to try it at home as well. Finally, we created a team of tiny taste testers made up of children from select centers across the country to try new meals and provide us with feedback. We know that healthy food is not benefiting our children if it ends up in the garbage can. So we employ cooks and a child taste testing process to ensure that when we implement a new menu, it will taste good and support the growth and development of the children. So Jerry, I just wanted to let you know this has been a great opportunity to share initiatives and ideas for giving kids healthy futures and to hear these great ideas from others. And I'm going to go ahead and turn it back over to you.
Thank you, Jody, really for your excellent and informative presentation as well as your leadership on all these wonderful CACFP innovations. Thank you. So now it's my pleasure to introduce Tracy Elhart. She is the Director of Babies to Kids Learning Center, and she's a National Association of Family Child Care state leader. And it turns it over to you, Tracy.
Thank you. Good afternoon, everyone. I'm so happy to be able to be a part of today's call. I started in the early childhood field about 10 years ago, and when I started, I really gave little thought to what children needed for nutrition and physical activity. I thought making sure that they got a variety of foods with some fruits and veggies was good enough for nutrition, and that if they just played being kids all day, that was good enough for their physical activity. But once I joined CACFP, my thoughts completely changed. Kids need so much more than that if they're going to continue healthy lifestyles throughout life. I learned more and more throughout the trainings that I took through my local CACFP and the ones offered through different webinars that I came across. I learned about different curriculums and started implementing those, and those led into new meal and activity ideas. But the point in my program where the biggest changes were made in these areas was when I worked on the CACFP National Take Action Challenge. The Take Action Challenge is an awareness campaign designed to educate, rally, and energize the child and adult care food program, the public and its participants. And the challenge motivates everyone connected with CACFP to take action in a variety of healthy ways. Through the challenges that I participated in with my program in the campaign, I learned about so many more resources and was able to share them with families and other providers in my area. I even ended up developing a couple trainings using my newfound education that I received through those campaigns and presented for my local CACFP. And with the knowledge of all these new resources, I've asked to implement different changes into my state's QRIS system. I'm lucky to be a committee member on our QRS oversight team in Iowa, so my input's generally taken into consideration, and we've actually added an entire section for physical activity. Our current QRS application only includes nutrition, so that's a big change, and I'm excited for that to roll out. As mentioned, I'm NAFCC accredited, and implementing health and nutrition curriculum helps me meet the standards for that, as well as on the QRS, which I'm a level 5 on. It's really critical to running a high-quality program. Go ahead and change slides, please. So some of the ideas that I use in my program and present about during different trainings are you can use books, songs, activities, and different curriculum to introduce ideas and get discussions started with the children. Next slide. Grow your own food, start a garden, allow the children to pick what's growing, teach the children about the growth process from the seed to produce, take different field trips. My children love the garden, and I recently became part of a farm to ECE group, so we're learning even more and hoping to expand that. Next slide. And with all that produce from your garden, you can do Make Today a Try Day, have different taste testing events, and use the different USDA Make Today a Try Day materials, which you can download for free. Next slide. Letting the children help plan some of the meals was something that I implemented as well. As the previous speaker mentioned, there's a lot of waste sometimes with the meals, so this helps us eliminate the waste to make sure that they're actually getting the nutrients that they need. Next slide, please. And the same with cooking together. When they cook together, they're more likely to eat what they try. And we've made our own cookbooks too, which we've also used on the USDA What's Cooking Mixing Bowl site. Next slide. And implementing family style serving, that was something that helped the children eat as well because they're not taking too much of an item and eating what they like. Next slide. And getting outside every day, that was the most important for our physical activity. Where I live, we have 4 seasons, and winter's particularly harsh. We can have snow up to 5 months out of the year. So we follow the child weather watch chart to ensure that the weather is safe for us to go out temperature-wise. And as long as it is, we're out daily, even in snow, sometimes even the rain. I'm a Nature Explorer certified classroom, so we have a full outdoor classroom, and that helps me have a variety of activities for the children to use when we're outside, no matter the weather. But for providers that don't have that, there's still plenty of opportunities to get outside and do activities. You can bring your indoor materials out, like we'll still even take blocks and dolls outside. You can always bring music out, and they can dance and have more space to move around rather than when they're indoors. And then there's the traditional standbys, such as bikes and ride-on toys, sleds in the winter, get the slip and slide out, and the sprinklers in the summer when it's hot. Next slide. So these are different items that I've implemented in my program and helped mentor others to implement in theirs. Child obesity is on the rise, so we have to do more than just that basic thinking. We've got to go above and beyond that. Children just are not getting enough physical activity on a daily basis, nor are they eating properly starting at young ages. Having a strong health foundation in an early childhood program is key to high quality program and for the health of children. Policy leaders can take action to help programs build a strong foundation for health, and relationships can be built between licensing, accreditation, QRIS, CACFP, and access to quality care and building the supply of quality care. So that is all that I have to present today. Turn it back over to Jerry. Thank you.
Well, thank you very much. We really appreciate all of your outstanding work, Tracy, and this was an excellent, useful, and engaging presentation. So now we're going to have just a few minutes to take questions. Krista and I are going to moderate the question and answer session, and we and the other speakers are going to be answering your questions. So let me turn it over to Krista, and just to let me remind you, if you haven't submitted your question, it's in the right-hand panel under questions. You just click on that small box. Krista?
Thanks, Jerry. So the first question, I believe, is for was actually for me, but I think Jerry and many of you can answer it as well, because I know that the answer is yes, but I don't know who. So the question was, are there any states where providers are using farmers markets, and are they offering providers discounts? And that was from Gina. And Gina, the answer is yes. I know that there are providers that are using farmers markets or doing other systems where, I don't know if you've heard community-supported agriculture, where they'll drop off boxes of food to folks. So there are lots of really great things happening, connecting farmers and farmers markets and childcare providers. And in fact, one of the providers I recently met in Baltimore does a lot of her shopping in farmers markets. I don't know if she received any discounts or not, but if anybody else, other panelists have examples that they'd like to share, please do.
Well, this is Jerry. USDA got a lot of team nutrition money through the Healthy Hunger Free Kids Act, and one of the grants that they put out was to Texas to look at the interface between CACFP providers and farmers markets and to try to strengthen that. And Susanna Reza was the person who worked on that, and they learned a lot and really tried to work out some systems for having a good interface. Of course, we also have the Farm to School network that has, since the new meal pattern was announced, has made a real focus on CACFP and Farm to Preschool. So they're also important. Do we have another question?
Yes, and so Gina also asked, I believe this question is for Jody, are companies going to offer the items in stores that she spoke about, the reduced sugar, yogurts and the whole grain pizza crusts and such?
Right. I'm sorry, can you repeat part of that question?
Yeah, are companies going to offer the items that you've helped develop that are healthier for children in stores?
Thank you. Yes, so we've already seen Dannon make their changes in the products that they're putting out to the public as well. And the manufacturers also, anything that we're working with them, that's available to anybody who's ordering them through their provider. So yes, absolutely, it's available.
Great.
Do we have time for one more quick question? Anything for Raphael or Tracy?
Oh yes, one for Tracy. So Tracy, can you give an example of a physical activity that you're going to promote during the winter season?
Well, my kids really enjoy sledding, so usually I don't get to get out too many of my pre-planned activities because they want to get the sleds out. But and snowball fights, making snowballs, and just building. We use the sandcastle toys that we'll use in the summer, in the winter too, with the snow, like the different molds and stuff, so they'll build snow castles. But we still take walks and everything in the winter too, but we're really child-led, so I leave it up to them. And then on those days where they're kind of, having a slump, then I try to throw out some activities. But wintertime, they're actually more than happy to just build and use the sleds all day.
Great.
Perfect. Thank you very much. Well, we're going to wrap up our questions section. If we didn't answer your questions today, or if you have questions after today's webinar, feel free to contact our panelists after the session. You will see a list of their names and emails on the last slide of the presentation. So as we wrap up today, I really want to thank today's speakers for their excellent and informative presentations, and all of you for joining us on the webinar. Let me just point out a few things. There are handouts under the handout panel over here on the right side. If you want to look at, we have 4 handouts there. Also, as a reminder, after today's session, each participant will receive a certificate of participation through Child Care Aware and Healthy Kids, Healthy Eating from Nemours. We're also going to ask you to complete a short evaluation to let us know how helpful this information was to you. We know that you represent programs from across the country, and we want to make sure we meet all of your diverse needs. So thank you again for joining us, and that ends today's webinar.